hand hygiene, health history, general survey, vital sign, and the pain assessment were completed prior to the start of the video and are documented for this assignment. During the head-to-toe assessment, I'm going to perform some of the techniques over the clothes. This is just for demonstrational purpose. In real life, we would do it over the skin. Hello, my name is Angel. I am your nurse for this evening. I'm going to perform a head-to-toe assessment on you, which will be done in confidentiality. Do I have your consent to do so?
Yes.
I'm just going to ask you a couple of questions. First, what name do you choose for this video?
JR.
Do you know the month and year?
November 2021.
Do you know what time it is?
1 p.m.
And do you know where you are right now?
University of Alberta.
From this, I can tell that my patient is oriented ×4. Okay, I'm going to start the physical assessment on you. Just let me know if you feel pain along the way. Okay, so starting with the head, I am inspecting the hair, and it looks like it has good texture and is evenly spread throughout. I'm also inspecting the head for any lesions, masses, and indentations, and it doesn't appear to be any. The head is normal cephalic, and the facial structures are symmetrical. I'm going to pull down your lower eyelids just to look at it. I want you to look up. From this, I can tell the sclera is white, the conjunctiva is clear and pink, and the pupils are round and equal. I'm going to shine a light in your eye. I just want you to focus on the tip of my nose. Now the other eye. So she has a consensual response to light. I want you to focus on the tip of the pen and follow it along with your eyes. So the cardinal movements and accommodation were tested and they are present. Now I'm just going to inspect your ears, checking for any discharge, any lesions, touching for any pain or tenderness. There doesn't appear to be any. Now I want you to lift your head up. Just going to check your nose. The nasal septum is midline, there's no discharge, and there doesn't appear to be any obstruction. Now I want you to occlude one, and then breathe in, and then breathe the other. There is a bilateral patency indicating no obstruction of the airways. Now I want you to open your mouth and say ah. So the teeth are intact, the lips and mucosa are pink and moist, and the uvula raises midline. Now I'm just gonna inspect the neck, seeing if there's any masses, any lesions. I'm gonna auscultate for bruise. And there aren't any bruise present. Then I'm gonna palpate for masses, tenderness. Doesn't appear to be any. I'm going to palpate the carotid artery. And it's regular +2 bilaterally. Now I'm going to move on to the upper extremities. I'm just going to feel around and look. The skin is well throughout. The same color. There's no masses, no lesions. Checking for turgor, there's no tenting. Checking the clubbing. It's less than 3 seconds. Checking the nails. They look clean, short. Now I want you to go like this. There's no sign of clubbing. There's a diamond. I'm going to check the radial pulses. And they're regular, 2+. Now I'm going to move on to the anterior and posterior thorax. So looking at the anterior thorax, I don't see any lesion, masses, heaves, lifts, no crepitus. Looking at the back as well, same thing. So for chest expansions, I would do it on the front and the back. For this video, I'm just gonna do it on the back. I just want you to breathe in. So my thumbs move apart, indicating a full symmetrical breathing. We can see the AP to transfer ratio is 1 to 2, indicating no Barrow's chest present. The breathing looks regular and with moderate depth. And so now I'm just gonna auscultate for breath sounds to see if they're present. I'm gonna do it anteriorly and posteriorly in a ladder fashion, going from the top to the bottom. I just want you to breathe in and just let me know if you're dizzy at any point. Okay, now the back. So the breath sounds are clear with no adventitious sounds present. Now I'm just gonna auscultate the heart. And then I'm going to do the same thing with the bell. So S1 and S2 are regular, there is no extra sounds, and there are no murmurs present. Now, I'm gonna auscultate the apical pulse for 1 full minute. And I use this phone as a timer. So 1 minute is up and she has a heart rate of 72, which is expected. Now I'm gonna move on to the abdomen. I want you to lay down. So here I'm inspecting for any masses, any lesions. The umbilical looks midline and it doesn't appear to, the color is all the same. Now I'm gonna auscultate before palpating and percussing just to not hear, because if I move things around, I might hear adventitious sounds. So I'm going to start with the lower right quadrant and move my way clockwise. So there are vowel sounds present in all 4 quadrants. Now I'm just going to palpate and feel for any tenderness or masses. Do you feel any pain?
No.
Okay, so we're done with the abdomen. We move up. Now I'm gonna perform the lower extremities. First, we're gonna inspect just to make sure everything's good. The skin color, that there isn't any lesions or any muscles. Gonna check for edema by pressing down with the thumb, checking for any depression. Doesn't seem to be any. The skin turgor, there's no tenting, indicating hydration. Capillary refill, less than 3 seconds. I'm gonna test the strength. You push down, good. You push up, good. I'm gonna test now the pedal pulses. Okay, and they're both good. 2+ bilateral. At this point, the health assessment, this head-to-toe assessment is completed. We have to make sure our participant is safe and comfortable, and if they have any questions, if they were in the hospital, the bell railings will be up and the call bell will be within distance. Then I will go and perform hand hygiene again. At this point, I would like to thank my participant for participating and taking part of this video. Thank you. There are a few things I want to clarify, and out of respect of my participants' time, I don't want to redo the whole video, so this video is just going to be quick. The first thing is, when I perform the capillary refill, I called it clogging, which is wrong. It should just be capillary refill less than 3 seconds. As well, I didn't test for grip strength, which is easy. You just tell them, squeeze my fingers as hard as you can, and she seems like she has good grip strength. Also, the abdomen, I didn't mention the contour, but it should be flat. And the extremities, I didn't check for the temperature. To do that, you just use the back of your hand. And it should feel cool to warm to the touch. Then when I was telling her to push down, I was testing the plantar flexion strength. And when I was telling her to pull up, I was testing the dorsiflexion strength. And for the pedal pulses, I didn't name them. This one will be the dorsalis pedis, and then this one back here will be the posterior tibialis. I want to thank my participant again for participating in this second video.